In continuation of our process, the next process we want to consider is how to transit from supine lying position to long leg sitting, and from long leg sitting how to get into half kneeling to standing. So the process of getting a patient from supine position to long leg sitting is as easy as what we are going to practice. Get your patient in supine, well relaxed. The next thing that you need to consider is to get the patient into a side lying position. How to do that is very easy. First, clear the path by getting the hand into forward flexion of the shoulder. Have a clear cut on the side that you want the patient to lie on. The next part is to get the other side onto the chest of the patient and maintain that. So as a therapist, your skills of log rolling play a major role in getting a patient into a side lying. So what you need to do as a log, meaning as a whole, we have to move this patient. We have a clear cut path, stabilize the shoulder, get your hand on the knee. First of all, rock the patient so that the patient gets ready for the movement. And then you give a stimulus by counting 1 to 3. So for me, I start with the reverse process. 3, 2, 1. I get the patient into a side lying. If he is an hemiplegic patient, make sure that the side towards where the patient moves or lies on is the hemiplegic side. That is very, very important so that it doesn't fall off. Get the contralateral hand well placed on the floor in this direction. Clear a path for the scapula where your hand is expected to rest on. Please make sure that your elbow is in place, because you are going to place your elbow on the scapula, and maintain a perpendicular force radiating from your shoulder to the scapula of the patient in this direction. When you have this, your other elbow goes towards the anterior superior iliac crest of the patient, which is here. Place your elbow in this direction, as you can see, separate apart. Then what you now need to do is to first of all maintain a radiating force going towards the shoulder. You don't have to pull any force from the hip. Just lightly flex this patient back while you resist the movement of the opposing side with your elbow. Then release the force coming from here when you have the patient in this force. Get your hand through the patient's neck. Hold this shoulder. Pull the patient back while you assist the patient with this. Adjust the patient's hand. Make sure it's parallel to the hip. The next part is that you can ask this patient to climb gradually in this direction. You keep encouraging the patient by weight shifting and weight lifting, as you can see, with your assistance. So this hand comes in this direction and this hand comes forward. And make sure that the patient is not giving a upright sitting. He has to give a little trunk flexion in order to change the center of mass so that the patient can bear the weight on the lower limb. So as this patient is sitting, this is how to get the patient into a long leg sitting, and it can be used as a facilitatory technique. We started with segmental rolling for bed mobility. This is the second level of our transitioning training. Now moving forward, when you have a patient in long leg sitting, get the strong side over the weakened side. Lock the ankle in this manner. What you need to do is that, remember, the patient is sitting with the two hands support. So if it's an hemiplegic, the strong side will be their heavily reliance. They rely more on that. So their weight needs to be shifted towards that direction a bit. Then what you need to tell this patient is that flex your knee. The knee that you are pointing out will be the strong knee. So while the patient flexing the strong knee, you help to unlock the opposing knee, and the patient use the strong side. Use the strong side to retract the other side of the leg while still maintaining balance on the strong side. Please, while practicing this, the process must be as quick as possible because the patient weight is on one side of the body. That could cause fatigue on the patient, so you need to translate the patient on time. So when the patient gets the knee into the back position, what you need to do is to encourage this patient to place the hemiplegic hand forward like this. Give your support through the shoulder as you are seeing. Then encourage this patient to move the other hand forward also, propelling, having the two hands on same parallel way, and then rock to quadruped position. Open the legs. This is the waking side. You have managed to get this patient into a quadruped position. Then the next thing will be that therapist squat in front of the patient with a little support. While you're squatting, tell this patient to climb through you. You have to give support on the hemiplegic side as you are seeing. Get your hand between the midline of the patient. Cross onto the opposite side. So you are targeting this side of the trunk. Place your hand in this direction on that side. As you can see, remember this is the strong side of this patient. Now you ask the patient to climb through you. As I'm saying, starting with the strong hand, give a support. Now, if this patient cannot move at all the hemiplegic hand, while climbing with the strong side, you have to assist this patient with the hemiplegic side. The patient keep climbing while you are giving support, and then climb onto your shoulder. Lock this elbow and give a support like this. Straight your hand, get it towards the elbow and place it on the shoulder. So now, when you have the patient in this direction, be mindful that this is the strong side and this is the weakened side. So what we need to do now is to get the patient into half kneeling, offload the weight from the strong side by passively prompt the patient towards this side, clear the path, give a support on the trunk side by holding firm. So I'm using the opposite side. So now this patient is offloading the weight. You assist them in getting the knee of the strong side into half kneeling. Stabilize the knee with your hand if you can. If you cannot use your hand, lock the knee with your knee and make sure that your back is straight to avoid strain. So you can passively assist this patient by torsioning on this trunk and get the patient into a standing position. Encourage the patient to maintain 10 inches distance between the legs to maintain balance. With this, you have managed to get your patient into a standing position. The process is very easy. We just need to understand the dynamic of the techniques. So as a therapist, be very sure of the steps involved. And if you have any query related to all this movement, you can get to us in the comment section or probably write to our email. We'll be glad to provide an answer to that. One of those key points that we don't consider in this video is the center of mass. So for purpose of understanding for the student that might be watching this, I'm going to encourage you to go and learn more about center of mass, because at each steps of movement in this kind of activity, the center of gravity and center of mass keep changing. So you need to know the center of mass along with the spinal column. So that assists you to understand clearly how we achieve the movement and why we cannot alter most of the movement. Kindly note that this particular lesson can be used for either pediatric population or adult cases. Just be sure of the process, the dynamism and the techniques. That is what is most important. Whichever way you want to use it, be careful of the clinical implications and be sure that it is ideal for your patient. Thank you for watching and hope to see you in our next series. Thank you.